Okay, so I had to post this. I'm getting a little concerned with the vitamin D lunacy that's out there. I've heard on a number of occasions of vitamin D levels well over 100 nanograms per milliliter, and this includes under medical supervision, which I feel is irresponsible. Clearly there are benefits to vitamin D. I'm not going to dispute that. However, there is also too much of a good thing. I frequently recommend people discontinue certain supplements for a few reasons. I often say that this handful here, for example, is doing nothing to address the root cause of what's going on with you. And although vitamin D can be supportive in an array of cases, when someone comes to me with gut dysbiosis, it's not going to change the equation. Vitamin D is not the magical cure-all solution, as evidenced by the fact that so many unwell people seek me out, many of them taking 5,000 IUs per day. Vitamin D is one of the more frequent supplements I recommend reducing, stopping, or taking a brief vacation from. We don't need vitamin D levels in the hundreds, the 90s, or even the 80s, and arguably the 70s. In fact, there are many studies which show that for people who live in a sun-rich environment and work or spend time outdoors, their vitamin D levels are at about 60 to 65 nanograms per milliliter. That's it. These people aren't taking supplements. They have lots of sun exposure, and this is what the body naturally allows for. So I ask you, if this is what evolution gave us, then why do we need to dramatically exceed these values? I hope you're enjoying the video so far. Don't forget to like, subscribe, and recommend to friends and family. Also, if you're feeling extra generous, hit the super thanks below. Beyond the vitamin D supplementation, I very often also hear in my consultations that there is concomitant use of high doses of magnesium, often for constipation but not always, and usually vitamin K. Now I get it, trust me, I understand what these people are trying to accomplish. But when in excess, this can be problematic. You see, vitamin D and magnesium work together to bring down blood pressure. But your adrenals have to compensate for this by producing aldosterone. But when these and other factors are at play, the adrenals can become a bit exhausted. So if you get dizzy often, or have very low blood pressure, or have restless leg syndrome due to the imbalance in calcium and magnesium, all things I hear at times, then you should reconsider your supplement regimen. Here's one more thing to think about. Vitamin D, which is actually a hormone, plugs into almost every cell in our bodies. So suffice it to say, if you have a bunch of activated hormone floating around plugging into everything, then strange things can happen. Well, how does this happen? Most of you will take vitamin D to increase your 25D levels in your blood. That's the number I referenced earlier, and that's the number on your labs. And when properly controlled within the body, your kidneys are responsible for converting that to the active form, something called 125D or calcitriol. However, you should probably know that there are a number of what are called granulomatous diseases, which can take the 25D and, due to macrophage activation, can pump out unregulated 125D, which has a number of implications, such as soft tissue calcification. What are these diseases that do this? Crohn's disease, lymphomas, sarcoidosis, and a couple of others, and tuberculosis. Now, when it comes to tuberculosis, I work with quite a few people from Eurasia who have had tuberculosis at one point. So this is a consideration for them. And of course, Crohn's is a poster child condition for dysbiosis. So I'm always cautious about vitamin D use with a Crohn's patient. Trust me, I'm all for intelligent supplement use. However, all supplements are not benign for all people. There are risks. This video is the first of several on this topic. Instead of taking supplements because you heard or read from somewhere that this is supposed to be good for me, which is another thing I often hear, perhaps it's time to work with someone who understands the biochemistry. In about 2 minutes, you'll see a video testimonial which lines up perfectly with the video on vitamin D lunacy you just saw. But before that, I have a few things to say. First, I'm always very appreciative of the people who give me the video testimonials. Out of the legions of people I help, very, very, very few people want to do a video testimonial, and I can understand that. Also, as part of this testimonial, you'll hear a few things mentioned. One thing is the fact that, as it lines up with the video you just saw, I've rectified vitamin D, calcium, magnesium, etc. imbalances in this particular individual. That happens pretty quickly, and in his case, it happened within 5 days. However, in full disclosure, I'm always also addressing the microbiome. And although you will often see resolution the first week for something like, say, diarrhea or constipation, the symptoms, the battle that's going on inside the gut usually takes about 1, 2, 3 or more weeks in some people to change the microbiome adequately. So no one can expect complete resolution from me within 5 days on all things. Another thing he brings up in this video as well is the fact that he was taking some L-reuteri probiotics along with some yogurt, and it made his symptoms worse. And I do not endorse probiotics, nor do I endorse fermented foods in those who are dysbiotic. And this is further proof to go along with what I talk about all the time. And I have a number of videos on this, which you can see. So with all that being said, I hope this heartfelt testimonial resonates with you.
Hello, my name is Wolfram Martinez, and I just want to make this quick video about my consultation with Guy Daniels, February 11th. I came to him with the symptoms of nausea, bloating, and anxiety, depression, burning legs, burning arms, muscle twitches in my face, dry skin, and what else? A lot of other things. But I was just a wreck, man. And I really didn't think there was something right. After seeing his videos, I decided let me do a consultation with him, and it was the right choice. Automatically, he pinpointed the fact that I was taking too much of this vitamin D with a K and magnesium. He said it's messing up your adrenals, they're working too hard, and it can cause symptoms like this. And I never thought that these supplements would do such a thing, because I've always thought that they're good for enhancing your health, and they just leave your body naturally. It's like I would assume like eating, but no, these things stay in your body and they disbalance everything. And I had debilitating depression and anxiety and panic attacks that I couldn't even wait at a stoplight without getting a panic attack at work, getting a panic attack driving to work. I thought I was gonna end up at a psych ward because I was going insane. And automatically he said, stop this. And he put me on something to recalibrate everything. In 5 days, I've become much better. And as a matter of fact, I used to have dandruff, and now it's pretty much gone. And my dry skin, it's getting pretty good. Better than that L-reuteri yogurt, which made my skin red and twitchy. Right here was all red and puffy one time. With Guy Daniels, this stuff just happens in 5 days, I guess, man. And I've never seen that. I've never seen it with a supplement. I've never seen it with a probiotic. And I did it because his platform's so new. And I thought, you know what? It's a good opportunity because you get to talk with him right now. And you don't, I guess, get stuck waiting. And it's just good investment for my health. Thank you, Guy Daniels, man. I appreciate your help. This is the least I could do for you, man. You've helped me a lot, man, and I know you're going to help a lot of other people, man. God bless.
If you liked the video, don't forget to subscribe. Also, somewhere around here, you can go to my website where you can schedule a consultation with me. You can also view the protocols, and here you can watch the next video.